Welcome to episode 71 of the Liberty Dad podcast, where we prepare for tomorrow's political conversation by how we engage today. I'm your host, DL, and this episode is Libertarians on 25 Issues, Healthcare. If you're new to the show, Liberty represents the message of all your freedom all the time, and Dad represents the delivery, recognizing tomorrow's conversation with my son is determined by how I engage with him today and then applying that to those around me. I'm taking the concept of a dad that can speak on many different topics and then applying that to Liberty. But speaking is not enough. It is important to be informed and speak in a manner that invites people to seek out your opinion in the future. This season, I'm joined by local Libertarian City Council candidate Jerry Rohrbaugh, known to many as Pastor Tub, or just Tub. Pastor Tub, a father of three, shares the same vision I do when it comes to communicating liberty. Prepare for tomorrow's conversation today. The theme for Season 3 of the Liberty Dad podcast is Libertarians on 25 Issues. Each episode will focus on one of 25 different issues from a libertarian perspective. I got the idea from the book Introduction to the Libertarian Party by Wes Benedict. In the next hour or so, you'll become more informed about healthcare from the libertarian perspective as Pastor Tub and I discuss. We'll also discuss the shooting incident on a production set by Alec Baldwin. With that, let's dive right in.
Hey everyone, today we're talking about healthcare. So as you know, we're going through this book, Introduction to the Libertarian Party, and in chapter 3, it's got libertarianism on 25 issues. So the first issue that we're going to talk about today, and we're not necessarily going in order, is healthcare. So here's what the book says. It doesn't say a whole lot. It says libertarians support a free market in healthcare, but not government-provided free health. You should not be forced to pay for other people's healthcare. And it turns out government lowers the quality of healthcare and drives up the cost. So what we're going to do is we're going to cover two major areas. We're going to cover one, why is it that libertarians believe this? And then we're going to flow right into why is it that we believe some alternative would be better. So if you remember, anybody that's watched, I have previous episodes, number 42, 43, and 45, which are self-ownership, the non-aggression principle, and freedom of association. I believe that when we look at those three concepts, that you will be able to understand libertarianism, and it will cover most any application in the world that we see today. Now, that doesn't necessarily mean that it'll cover everything. That doesn't mean that there isn't nuance. But the idea behind these episodes are just to give people a much better understanding of what it is that libertarians believe and why. Pastor Tubb, how are you today?
I'm stellar.
All right. So when we talk about healthcare, it's a big topic these days. And the biggest issue I think that we have is that we don't really talk about why we believe it. So Pastor Tubb, I'm going to see if you want to lead us in as to why do you believe? In fact, maybe I should even ask.
Okay.
Do you believe that healthcare is something that should not be government provided, that there should be a free market in the healthcare system?
All right, yeah, in the sense of that I don't believe that government does it well.
Okay.
So that's a pretty good reason of why they ought not to.
Mm-hmm.
And I believe that we have some self-responsibility inside of that. Now, naturally, that doesn't just make it fall into place.
Right.
You know what I'm saying? So there's always going to be these things that come up. And what I kind of wanted to mention was that, like, I like the back and forth of the ideas.
Mm-hmm.
Okay. I believe that we can throw forward ideas that sometimes even seem absurd at first.
Right.
But as you start kind of going through them a little bit, I think you can start finding something that works.
Right.
Okay. And I think that's kind of what we have to do, even as libertarians. We meant to throw out what seemed like some crazy ideas to get the conversation moving to where you get into an area where maybe it can work.
Right.
Because I think that there's so much in place already with government involvement that it's going to be hard to just pull the plug on that. It's going to be hard to just pull out and say, okay, now best of luck to you, y'all go figure it out.
Right.
So I do like the idea, and I think that we'll kind of learn as we go forward in this, that you'll hear me sometimes, I'm going to throw out some crazy ideas, and you're going to go, Tub, that makes no sense at all.
Yeah.
And you're probably right, but I think we can kind of go down that road a little bit. Also, I think as we do, I like to question things.
Mm-hmm.
And even if I'm already in agreement with you, and I kind of want everybody to know this, that even if we're in agreement, I might kind of question some things about like, hey, wait a minute, this doesn't make sense. And I might even believe and agree with you, but just kind of get to the other side of it, because you know, as libertarians, as we get out there with something that we make a stand on, there's going to be other people pushing back.
Right.
So I think we just try to equip ourselves. And I probably gave you more there than what you were initially talking
No,
and
that's
asking me
good.
for. Okay.
That's good. And so what we're going to do is we're just going to talk about it. And sometimes Tub may agree, sometimes he might not. And that's okay. Because in the libertarian community, people have a variety of views on everything. So there is, there are some general principles that we fall under. Speaking of general principles, so let me talk about, I kind of mentioned it a moment ago, self-ownership, the non-aggression principle, freedom of association. So here's kind of a segue into why do we believe that the government should not be providing health care for individuals. Now, the overarching simple answer is because they don't do it very well, right? But the question is, why don't they do it very well? And so one of the things that I believe is that everybody owns their own self. When I own myself, that means I own the things that I do with myself. So it doesn't matter whether or not it's my time that I'm being invested. So for instance, right now, I'm spending my time here with Pastor Tubb.
Sorry.
And we're having a good conversation. We will have a good conversation about healthcare and many other topics as future episodes come out. Because of I'm using my time as I choose, because Pastor Tubb is using his time as he chooses, we are both going to seek to maximize the value of that time. This translates very much similarly when we get into things like business. So healthcare, or maybe if you're an auto mechanic, or if you're a lawnmower, if you're a lawnmower, but
if you are a lawnmower,
yes,
all right.
If you're a landscaping person, whether you're doing elaborate landscaping or you're cutting lawns, doesn't matter. That is your time that you're using, and you're going to seek to maximize it. You're going to make sure that you get out and get as many lawns cut as possible for the best price possible in the shortest amount of time possible. Because it is much better to cut 1 yard in 20 minutes and get $20 than to cut it in 1 hour and get $20.
You're basically making yourself a business, and you want the best return on investment for your business. Like, I'm my own business, and I got to run my business efficiently and what's best use of it.
Absolutely.
Same concept. Okay.
Right. So I look at it and I say, in the healthcare industry, doctors, administrators of hospitals, nurses, anybody that's involved, they all are trying to maximize their time. This also goes for, and we're not going to get into it too much, but this also goes in the time that leads up to it. So somebody might say, you know what, I want to be in the healthcare industry, but I don't want to spend 12 years studying. They might say, I would rather only spend about 4 years and get out and just get into it. So they may sacrifice a potential future in, as a surgeon.
As a surgeon, exactly. But not everybody's surgeons anyway. Yeah, if they can kind of determine, and then, I don't know, maybe I'm jumping ahead here, is that we can then also say, hey, this is what I need. Like, if you notice, like, nurse practitioners and stuff, they're becoming the thing. And I had a guy actually explain to me, he's a guy in the Navy, he's like, no, this is really the future of what's going to happen. You're going to have one doctor, and you're going to have about 7 or 8 nurse practitioner type things, PAs, and they're going to really be doing the hands-on type of work. And the doctor, and let me be honest with you, when I go, I don't really care if I talk to the PA. That person has more knowledge than I do, and so I'm willing to trust them. Now, maybe there's a level of, we get past their expertise of their understanding, then the doctor jumps in, and I'm fine with that also. So I think that kind of feeds into what you're saying, that they didn't have this desire to do the other 4 years that leads them in a certain direction. They go, I'd rather get involved right now. And then they can start being effective right now without the personal costs of taking things on.
And this applies to anybody that's getting involved. So anybody can come along and say, I want to be in the healthcare industry, and this is how I choose to use my time. And there's a number of considerations, right? It's not just a matter of time. Somebody might say, hey, I would like to be a surgeon, and then they may narrow it down. And I'm making some assumptions here because I'm not a surgeon, but I'm going to assume that some surgeries require a lot more time and effort into preparing and studying for. So I'm going to assume that maybe if you want to be a brain surgeon,
I want you to study up a little bit. I want that guy to be on top of things.
That person may need to spend a much greater amount of time in a much greater investment with their time
than
studying.
A dermatologist with a skin cancer type thing.
Correct. Than somebody that's making minor surgery, somebody that's giving stitches or something like that. And so for me, self-ownership, the idea of self-ownership applies to every single individual that's involved in healthcare. Then we have the non-aggression principle. The non-aggression principle is a relatively simple thing. Libertarians love to debate it. We're not going to debate and have all the finer nuances discussed right here, but we're just going to break it down to something simple. You do not have the right to aggress against somebody else. In other words, if Pastor Tubb and I are talking and I get mad at him because maybe he said something offensive or vice versa,
Well, it's
one of
safe.
us cannot just reach out and punch the other one in the face. This is a violation. However, if Pastor Tubb and I are maybe we decide that, hey, you know what? Let's go in the boxing ring and have a little bit of fun.
There, it's expected, exactly.
Right?
Or if we agree beforehand,
Right.
hey, no, we can punch each other during this time.
Right, which I have not agreed to, by the way. So if anybody sees him assault me, he is violated.
Okay.
Right. But we might want to get into the ring and just say, hey, you know what? Let's go box it out. I've been feeling frustrated. He might be feeling frustrated, or maybe we just want to get some energy out, right? So we go and we agree to go in and box, and we agree to certain terms, right? So it's not a violation of the non-aggression principle. But when somebody forces you to do something, if it's the government per se, if they force you to do something, then that is a violation of the non-aggression principle, even if they didn't actually commit an actual act upon you, because they're using threat. A legitimate threat.
In my mind, because I go different places, and as you're saying that, and here's what I'm thinking, all right, well, because here's what's funny, here's where it's proof where that holds true, in that the government, when they allow somebody to practice medicine, they don't say only people from these schools get to practice medicine. They don't even say you got to be the top of your class.
Right.
All they're basically saying is you have to have this degree from this place,
right.
and you got to be able to pass what we tell you is enough.
Right.
And now you can have at it.
Right.
So basically, if you think about it, we're all already doing this anyway, because I have never been to a doctor that's gone to Harvard.
Right.
So aren't we already doing a level of, I'm fine with the idea that it's not this person at the top of this game, and
right.
I'm still comfortable with seeing them.
Right.
Those doctors have already made a similar decision, not so much in the what do I want to specialize in, but how much do I want to spend to get involved in this?
Right.
Do I want to go to Yale?
Right.
Or do I just go to state school in a sense? You know what I'm saying? So it's already there. The concept is already there.
Right. Yeah.
We're just we want to spread that out and give us the same say inside of it.
Right. Right. And then we get to freedom of association, which basically means kind of what he was alluding to. I could go to any doctor that I want. I could choose to say I only want to go to a doctor who's been to an Ivy League school.
Yeah.
It might be more difficult because there's probably going to be fewer of them. But there may be a good reason for it, and I'll actually get into that in just a moment. But I might just say, you know what? Any doctor that's been, that's been accredited is okay with me.
But accredited by who?
Right. And so this leads into this more free market idea.
Okay.
Right? Like so how does the free market really handle certain things? And it's funny, whenever I talk about occupational licensing, and I say, oh, we shouldn't have occupational licensing for barbers, the first thing that people want to jump to, will say, so you want a surgeon?
Exactly. Like there's no in between in there anywhere. Right. It's either you're either cutting hair or heart surgery.
Yep.
But I think there's stages in there. But I will agree with you, because we've had this conversation briefly before with the same idea. And I will tell you what, the lady who cuts my hair, I've talked to her, and the stuff that she has to review and take courses for every year seems absurd for what she's trying to do. But guess what? Government says she has to do that in order to fulfill that role.
Right. So here's where we're actually going to address this issue of surgeons, because we're talking about healthcare. So I can't really talk about barbers now. So I've kind of backed myself in a corner, but it's okay. Because I think the misnomer, what people misunderstand, and it's really the libertarians' fault for not really making clear that a lot of the things that we see now in the system would not necessarily go away. What would happen is we would simply shift the responsibility. Okay. So instead of saying the government is going to license you, it may be a governing body that's made up of
peers, stuff along those lines. Okay.
People that have that have risen to the top of their game, and they, and
can
so
I get real libertarian on you for a second?
Absolutely. Let's
All
get
right.
real libertarian.
Who's
I'm not a libertarian.
Exactly. Yeah. So who's going to form that board?
It would be the same as who forms any organization, right? A body of people.
Okay.
They come together and they say, we're going to form an organization, and then they put their name out there and they start developing a reputation.
Okay.
Same way, like say Consumer Reports. Who put together Consumer Reports? presumably somebody had an idea. They got some investors together, and they said, we're just going to start reviewing everyday items, and then we're going to publish these reviews.
And then you
and
can kind of weed through that after they've done the heavy lifting.
Yeah. And I assume at first, when they first got started, few people heard about it, and now they have a reputation.
Do we run the risk, though, of these self-governing boards, of people saying, well, I think you're wrong, and I'm at this level, and you should all be, like I said, does there become this level of infighting? Like, once again, how do you determine who mans that board? And I will tell you this, I hate this that you brought this up, because when you told me to read through this and see what I come up, I got a whole different direction than what you're talking about here.
It's good.
But what I'm saying, though, is that these are the things that are going to naturally happen. It goes back to what I alluded to at the beginning is how long is this process? It's not a pull the plug on.
Right.
These are things that we have to I think we have to address rather than just throw an idea out there.
Right.
We got to kind of look into it a little bit.
Right.
So if we have boards that have determined this is what we're going to do, continue down that road for a second.
Okay, so we'll continue down that road. We have these boards, we have these groups, this organization that pops up, and we already have them actually.
Yeah.
We have like the American Pediatric Association. There's all manner. You go and you start looking, you're going to find it. There's all these organizations that already exist. Now, did they come into existence at the behest of government? Maybe some of them did. I think a lot of them did not.
Right.
And they have since petitioned the government and said, you need to make this a mandate. And so where many libertarians at least, maybe even most, or hopefully all, in my opinion, would agree is that the ideal situation is that you'd have this organization and their reputation would be built on delivering good advice to people and saying, this doctor is a good doctor, this doctor is verified, we have evaluated all of their studies that they have, everything that they have studied, we've approved of, we think that they've met these certain qualifications that we believe is going to make for a good doctor when you come and see them.
Now, once again, because I like to do the trouble part of it.
Do it.
So when this doctor who's just getting started comes and says, hey, I really want you to recommend me. Here's what I can do for you.
Right.
Don't we start running into a level of corruption again?
No more than what we already have.
Okay, but so
that's the thing.
So our goal is not to just have an equal level of corruption. We want to get rid of the corruption.
Well, what we want to do is so the challenge with the corruption is, first and foremost, I don't believe that you can ever entirely get rid of corruption because you have the human factor. But what I think we can do is when you start getting into the free market, then what happens is the free market is kind of like this abstract thing, right? And when you have this abstract thing that anybody can engage in, then that means the sheer competition of it forces people to be at their best.
Yeah, okay, you're right. See, because the argument is often made that, well, without the government to tell us, the standards are going to drop down. And I kind of see it the other way around. That once they're forced to pick up their game, it's not that just the government says they're okay and now they're fine. They're forced to prove themselves at a certain level. And if you don't prove yourself at that level, guess what? People aren't going to come. It's just that easy because there's another guy over there that could be their doctor or can perform these things. If they're a lawnmower or whatever it is that I think that you get rid of those things, it forces people to bring their skills and their levels up, or they're just going to, and what I refer to as pander to this level. And I don't think that's bad either. In the sense, like I use the example of like, there's a reason why we have a dollar store, a Walmart, and a Macy's. People go to whatever level they want to be at, whatever level they trust they want to, and they might, for this here, they might go to the dollar store. For this, they might go to Walmart. For this, they might go to Macy's. Same premise is there. Is that the standard will be where you're willing to be at? Because I think that, I think we have to be cautious if we say, hey, this is how it's going to be, and we're now going to expect everybody to be up here. Well, guess what we just did? We started the same problem again. Everything's up here. Everything costs so much more. All the standards. Whereas people go, I'm fine right down here, and I'll camp, because we might go to the doctor for lesser things if we go at all. And so we don't need to see the specialist. We just need, you know what? I got this pesky cold. It's driving me crazy. I need a prescription. And I'm done with this. So as you talk into the free market, that's the direction I started going to, and that's where I started hitting it. I'm kind of like,
what do you got?
Okay, so
shift.
My thing was, I started looking, I go, wait a minute, this to me seems like a perfect opportunity for the barter system. Like, I love the barter system. I love the idea that says, okay, well, you're a doctor and I need this done, but I'm a landscaper. We'll keep with that example. Okay, you don't have time to do your lawn. I'll do your lawn for you if you're willing to treat my family.
Right.
And I started looking at this. I go, wait a minute. So now that's true free market, because now we've pulled money even out of it. We pull in this fallen currency that's a mess right now anyway.
Right.
We've kind of pulled that out. And as I started looking, I go, wait a minute. This isn't a bad idea.
Mm-hmm.
So then I realized that like all my great ideas, somebody already thought of them. Okay, so it wasn't an original great idea. So here's what I did. By looking through, I actually found there's a place up in Maine, and what they do, it's a program. It's called True North, and it's in Falmouth, Maine. And this is basically what they do. They have what they call the Hour Exchange as part of a Portland, Maine program.
Right.
And what they do is they put a level of, if I do this, this equals this type of thing. Money is not involved at all. And then what you basically do is you earn hours towards time with your doctor.
Right.
So as we're going to see in this video that's coming up, hours with your doctor is huge, because we're not getting that time.
Right.
And so they can take whatever skill they happen to have, like I'm a roofer, and they can negotiate this beforehand. They can go, hey, wait a minute, I believe I can do this, but it's going to be X amount. I want you to treat my family, all four of them, 4 hours each of them, and this is how we do that.
Right.
Great idea. Already happening.
Yep.
And I like that, because if it's already happening, we can look at that. The good thing about it, you can kind of look at it and go, okay, this works, this doesn't work. But more importantly, you have it mapped out. And if it's happening there, why can it not happen here?
Right, right. And I think that leads us into, so we've kind of explained the why do libertarians believe this, and the why is going to largely be on the basis of principles, right? Like we have these principles of self-ownership, the non-aggression principle, and freedom of association. But now we're kind of getting into the, why do we believe that this works better? Because that's the real uphill battle. Because people want to make sure that if we say, okay, we're going to pull government out, and then what's going to happen? Or is it going to be, am I going to go to a doctor who says he's a great doctor?
He's a cab driver.
Right, and he's a cab driver. Nothing against cab drivers. But if you're a cab driver and you're not a doctor, then you probably shouldn't be doing doctor things necessarily, right? And when I say necessarily, there may be small things that you can, let's face it. You call up your mom and you're like, hey, Mom, I got a headache. And what does she do? She's like, take this pill, take a Benadryl, take a Tylenol, take a Dr. Mom kind of a thing, right? So it's not that people can't necessarily operate in any in other spheres,
right?
But there is a certain degree or a certain point to where maybe they shouldn't be operating,
right?
Just because my mom could tell me what things from the cabinet to treat my stuffy nose or hay fever or what have you, doesn't necessarily mean that when I come to her and I've got appendicitis,
I say, yeah, Mom, is this where I cut?
Right. Like that doesn't necessarily mean that. But
I think that once again, if you take what you're talking about, these boards and say, hey, okay, no, this is a legit doctor. And the thing is, right now we have the luxury of these are already established, government approved doctors that we're not starting the whole system over. We're actually going to pull from ones that have already proven themselves. They're already sustained. They already have this. The good thing about that is the ones who have done it, now they can start kind of bringing up the next ones and start saying, okay, I know this young doctor. Here's what he's done. Here's what's going on. They bring them in and they start replacing them as they move up the line.
Yep.
And so it kind of does fix itself out a little bit. And we can kind of follow a model. It's not like we're having to tear everything down when we can follow something that's already there.
Yeah. So let's get into that video real quick.
Oh, okay.
So I'm going to play that video. And so just to kind of give you a little bit of primer of this video, you may have seen this person on CNN lately. And this is Dr. Leanna Wen. I strongly disagree with this woman on anything that she's had to say about the pandemic practically, because she is, in fact, I've jokingly called her lock 'em down Wen, which is, maybe a little unfair, but she went on CNN a number of times and advocated for locking people down. But that's not what I want to show you. What I want to show you is she wrote a book, and I believe it was back in 2015. She wrote a book called When Doctors Don't Listen. And there's an interesting video that you can find in the show notes it's about an hour-long video of her talking about this book with a bunch of people that have come to this bookstore to hear her talk about the book and just the concept of doctors not listening and improving healthcare. So this is about a 1-minute clip, roughly, just a really short clip, and we're going to listen to it and we're going to hear what she has to say about this. And so she's leading off and talking about what are some of the major problems in the healthcare system. So let's go ahead and listen.
So what's happened? Two things. The first is an issue of time. In our medical system, doctors are not reimbursed to spend time with patients. We're reimbursed to do things to patients. A procedure, a test, all of these things are pay, but time spent with someone to figure out their history is not what's actually going to pay at the end of the day. And as a result, primary care doctors are limited to 15 minutes per patient. I'm an emergency physician, and I can tell you on an 8-hour shift that I would see 50, 60 patients. I mean, how much time is that to spend with the individual patient, right? And yet it's not the doctor's fault that this is a system problem that has to be addressed overall. But as a result, then, doctors resort to what we call checklists of things to do. It's just easier, and it saves time to order all the same labs and all the same tests if you have chest pain, regardless of whether it's a muscle pull or whether it's something else. And that type of cookbook medicine is something that could lead to unnecessary testing, but also to misdiagnoses as well. Another problem is that of increased technology. Now, I'm certainly not a Luddite. I'm not saying that we should, ignore technology altogether. But let me ask you this. How many of you have had the experience of going to see the doctor, and there's a computer between you and your doctor? Has anybody had that experience? The doctor's looking at the computer rather than looking at you, and they're typing and not really listening to you. Well, again, not really the fault of doctors, because we have so much documentation now that it's very difficult to keep this up unless we're typing as we go along. But what does that do? So there was a study done of resident doctors. It found that of all the time that resident doctors spend in their day, they spend 12% of time interacting with patients versus 40% of time interacting with their computer, which I guarantee you that is not what our residents want to be doing. That's not what any doctor wants to be doing, right? Spending 3 times as much time interacting with their computer. But also what happens as a result of this. Let me ask you for another statistic. When you go see your doctor, and the doctor says to you, Mrs. Jones, how are you? What brings you to see me today? How much time do you have before the doctor interrupts you? Any guesses? 30 seconds? Any other guesses? 5 seconds. We're really pessimistic here. Anybody else think higher than 30 seconds? 2 or 3 minutes. Okay, and I'm sure that this number varies, right, depending on the doctor. But according to a study done about 15 years ago, that number was 18 seconds. And a more recent study actually is closer to your guess. It's 10 to 12 seconds. So imagine, I want you to think about 10 seconds. Think about you're talking to your boss. You're talking to your spouse. You're talking to someone and trying to convince them of your point of view. How much can you get across in 10 seconds?
Let me just start with this.
Yep.
If I think I'm only got to speak to my wife for 10 seconds, it's not going to go over well. Like we could just squash that one now. Now, here's what's funny. As she was going through that, in my mind, I was going 15 seconds. And I even thought that was kind of like, I'm like, this seems low when you really think about it. And then when she said that, I'm like, oh my God, 15 seconds is okay. I'm trying to explain what I've been dealing with, because if you're like me, we probably don't go as soon as we feel something. We wait a while and we try to, and so I'm like 15 seconds before he finally cuts me off to do the next thing. And then real quick, and then I'll let you go, is that I mentioned to you before, I said I started going to this new doctor a little while back, and it was the second time I'd gone to him. And he looks at me and says, okay, he goes, well, hey, I'm going to pass you off. I'm like, I kind of looked at him, he goes, I'm retiring. And he's not a very old guy. I'm thinking, man, doctoring must be paying pretty well. And that's not what it was. It wasn't financial or anything. What it was is that complaint that she just said was that he found he spends way too much of his time typing on the computer, because he actually made it, the computer's right there, and he would actually do a lot of dictation while I was sitting there. And he truly was, this was the bulk of his time with me.
Right.
And he pointed that out, and I'm like, okay, so when I hear this, and as crazy as you think she is now, that's a pretty good video right there. Like that kind of gives us some pretty good insight. And real quick is that is kind of what I'm saying. Imagine if you bought this time through this barter system that they already have in place, that you're getting technically an hour. Think about that in comparison, how much better that actually looks.
Oh, and I can speak to that personally, because a long time ago, and we won't get into all the details, but it was determined that, or discovered that I have a rare inner ear disorder, actually on both ears. Right. So very lucky. Rare to have it in the
You're
first
lucky
place.
to have it the way you said that. Very lucky. I had it with both ears.
Right, because not only just one ear, but I got it in both. Right. And I went to a doctor here in Jacksonville.
Mhm.
It was an otolaryngologist, I believe. Yeah, I think it's a term. It was one of those big, long
That's a
words that
government term. Mhm.
I'm like, I can't even pronounce that hardly. And I had already done some reading and I'd done a whole bunch of my own research. Yeah, people that hate researchers, yeah, this was me.
This-
or whatever. So I done all this research, and I went to this doctor, this ear doctor, and he wanted to do a particular procedure, and I was like, man, I don't feel like that's the right one for me. And so in my research, I'd come across a doctor who operated out of Louisiana, and this guy had a stellar reputation for people online. People all over the world would travel to come see this doctor for the very same inner ear disorder that I had. And one woman, her experience was so amazing that she wrote a book about it. Now, I haven't read the book, but like this was like the
She wrote a book about her
experience
with that doctor.
the experience with
Of the idea. Oh,
with
okay.
the whole
All right.
inner ear, but then
Okay.
it also included the doctor as
Okay.
well. And just to give you an idea just how serious this issue was, there was a family from, I want to say it was Sweden.
You say it. We
And
don't know.
I don't
Use it.
remember the name.
It's, you know, it's fine.
But I think it was Sweden. And their child had had this sudden onset of it. And he basically couldn't stand because he was just like dizzy and he had all these auditory issues. And so it was really debilitating, like to the point where he could not function. They had to charter a plane, and I think they paid for extra seats so that he could lay in a certain way
Mhm.
because he couldn't sit in a normal seat to make the flight from here, or from, I think it was Sweden,
We'll go
to
Sweden.
here.
Mhm.
And this doctor resolved his issue, and it required, surgery and all that. Now, what's amazing about this doctor, and it's not going to sound amazing, he doesn't take insurance. But because he didn't take insurance, and this is the reason why, because I was like, well, how come you don't take insurance? Like, because this was my first experience with this idea at all. Because before that, I was just like, yeah, I was the regular person. You go to a doctor, government
and I take
doctor,
my
right?
insurance card in with me, and I
You
go,
take
okay,
your
here we
insurance
go.
card, you might take a look at his credentials on the wall, maybe, while you're waiting for him. Otherwise, you probably don't care,
Actually, I thought we
And-
just do that on Facebook now. Like if there's
Right.
a new doctor, like, hey, anybody know a doctor for
Yep,
this?
yep,
That's how I
yep.
found my most recent one.
Yes, and this is part of that free market, right?
Right.
Like you crowdsource from people that have had the good experience. I basically did that very thing. I crowdsourced. I found this doctor, and he had all these great reviews from people that had that had much worse symptoms than me.
Mhm.
But more importantly, he was known to be kind of like at the top. One of the top doctors in treating this rare inner ear disorder. So I went and saw him, and here's the interesting thing: when I first called up, I think the woman on the phone spent almost an hour with me on the phone before I was even a patient.
And that's $0. No,
They got
free.
no money for that. No money. Spent about an hour because she was explaining everything. She was like, look, this is how we operate. We don't take insurance. What we're going to do is we're going to send you a lot of information. It's going to have all the CPT codes so that you can contact your insurance company and you can get an idea of what they're willing to pay for. And they said, this is how much we're going to charge. They told me before I ever stepped foot into their office how much everything was going to cost. So the first round of testing, how much you're going to be charged?
And that's a huge difference right there.
Yeah.
And I know they were trying to do this thing years ago. They were saying that if doctors would make commercials like that and say, hey, for a physical, come in, it's $20.
Right.
Well, guess what starts happening? Now all of a sudden one goes, I could do it for $19.
Right.
And that's not a bad thing.
Right.
You know what I'm saying? Because now we can go through, once again, we find the level of what we're looking for.
Right.
And we can pay, I could pay this much to get my physical.
Right.
And off we go.
Yep. And it's possible that I could have went to the doctor here in Jacksonville and he could have done the procedure and it would have been, probably would have been fine, right?
Mhm.
Like, but I had done my own research and I said, I don't think that's adequate for me.
Let me
so
ask
then
you
I saw this guy and he not only agreed but explained in depth why. And I'll give you back the
I should have a question for
Yeah.
you about that. Okay, so when he said he doesn't take insurance, were you able to use your insurance? Like you made it sound like, okay.
So we had to pay out of pocket to him and then get reimbursed from our
Got
insurance.
it. Okay.
Right?
All right.
Now, in this particular case, we're talking about a rare inner ear disorder. Ended up having surgery. So it was still a hefty number. I'm not going to divulge that number, but it was a hefty number. But we are talking about something that was very much out of the ordinary.
Right.
We're not talking about like, hey, I have some stitches because, I cut my arm out in the yard working or something like that, right? So when I went, my first, they told me, they said, when you meet with this doctor, you are going to spend about an hour with him. I got 1 hour of his time.
Like, you legit got an hour of his
Right.
time.
And here's what happened. He sat down and he listened to everything I had to say. Everything. Now, I spent more time at the doctor's office the first because he had like a full suite of doctors. So I ended up, sitting with his audiologist, and I did some other things, and I had some tests, stuff like that. But of his personal time, I spent about an hour sitting there talking to him, and I told him everything. Anything that, like, I was like, all right, this may sound crazy, but what about this? And he's like, yeah, actually, blah, 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 blah. And I felt so comfortable telling him everything. So if
you get 15 seconds or 8 to 10, you're not going to get a chance to do all that before he's like, no, dude, no, I just got to get to this. I got to get to this.
And it was an amazing experience.
And you'll pay up for that. Yep. There's the thing.
Yes.
It's the idea that it's the same thing if we want to take it away from doctors for a second and put it into a restaurant and the service. Listen, there are sometimes I'll go to a place, I'll pay up knowing that the service is better.
Right.
Same premise.
We expect it.
Yep.
And then when we don't get it, we get upset. We get more upset.
And they get on Yelp. Is that what it is? They get on Yelp and do all their complaints.
If we go to Ruth's Chris and they are a little bit rude to us, we're going to be stomping angry.
But at Waffle House, they do that to me all the time. And I'm kind of, hey, I have to fight them. There's no fist fight. We're good.
They've been breathing grease all day. Like, what do I expect, right? Of course, they're going to be angry. Like, they can't breathe.
Right.
There's grease in their lungs. But, so we have different expectations.
Did you have to pay for that hour with him?
I think so. I think
which is fine. I think. Here's the thing: is I think that they have every right to. It is their time.
It was more like I don't want to say I paid for an experience, but it almost feels like that, because what happened was he was like, you're going to come out and you're going to spend basically an entire day at my office for the most part.
Okay.
An hour of it is going to be spending time with me, but then we're going to put you through a battery of tests. And so there was all these weird tests that I had to do because, we're talking about the
Let's make sure,
that. So I'm like in this like little gyroscope, and he's like spinning me around, and and they're measuring things. They got like things hooked up to my face so they can measure like my eyes, and they're taking all these crazy measurements. And so they did all these things. So it was just like it was like a whole day long.
But you knew that walking into it. The best part about it is that you knew the expenses.
Right.
Like, because you could look at that beforehand and go,
right.
Oh, no.
Yeah.
Like, I'll just walk around deaf for a while, or whatever that happens to be.
I got off the phone. I had a strong idea of exactly how things were going to play out. And then I got an email, and it was like, there's all these PDF documents, and it was like, here's the cost of everything. Here's all the procedures that we're going to do. Here's, expectations.
Is it almost a la carte? Could you pick and choose? Like, hey, no, I don't want to do this one. But he's saying, no, if you want to come to me, here's how it's going to be.
Right. And honestly, with all the tests, I had no idea what they were anyway. So I was like, I'm like, okay, it's like, it's a bunch of names that I can't pronounce. I'm like, okay, I assume that he, and maybe I could have done it, but it seems like it would have been weird. So it was all kind of rolled up in this one big price, to go and see him. And then after that, he gave me, the diagnosis. He explained in full detail exactly why he believed that I was on the right path. He had a different reasoning behind it than I did.
Okay.
Right.
That guy who was very smart and everything, he had a different. He came up with a different thing.
So he agreed with my solution. He just had a different reason why, and he explained it in full.
Oh, so you were right, is what you're saying.
I mean,
the doctor just agreed with you.
He did.
Okay, so here's what's funny, and it's along these lines. It just makes me think of it. Is that I recently had to go to an ENT doctor. Turned 47, everything falls apart.
Right.
And so I had to go to an ENT doctor, and I wasn't keen on it, but I went. And now here's where this all kind of comes in. First, we found out, hey, who do y'all know? My wife got on Facebook and said, hey, who's a good doctor?
Right.
And they told me his name. Really nice guy, like great guy. So I go and never been to an ENT before. And so he starts this process. They have things that they want to do.
Right.
Every time I go, they want to do this. And then here's what I found. Because every time I go, they charge me to do that.
Yes.
And so they're running numbers. They're running money. Hey, go see this other guy who works with us. Get this hearing test done, stuff along those lines. And then the last time that I went, not to mention I pay a copay of $100 every time. And then there's still this extra paying that goes. It keeps growing, which is part of government saying, hey, we'll move them here, put them in there. So the last time I went, he explained to me, he goes, okay, here's what you have. Here's the problem. He goes, that ultimately, this is something that it's going to turn into a long-term problem. And I was like, okay. He goes, but sometimes it takes decades. I'm like, okay. And he goes, you're 47. He goes, so it might not ever affect you. I go, okay, good. Thank you. I appreciate it. So I head on out. He goes, okay, we're going to have you talk to our scheduling lady on the way out. And I'm like, okay. And so I go out there, and then she's scheduling. She's going, okay, well, in 3 months, he wants to have you back again to check,
Right.
a follow-up. And in my mind, I'm thinking, why do I need to follow up? He's already told me. I already got what's going on. And she goes, well, we're going to schedule a thing for you to check on some hearing devices. And I'm like, hearing devices? I don't need a hearing device. I'm fine. Like, I can hear it's muffled some, but he's actually saying that.
I heard that.
Yeah, exactly. I heard what?
More money.
And that's what. And let me be honest with you. I'm sitting there, and this is going through my mind. And here's what happens. I think people at that point feel pressured. I think they feel like this is the doctor. He knows what's best. I better just travel down this road with him.
Right.
And I looked at the lady and I go, can I schedule my 3-month one? Can I make that schedule when it gets close? She goes, oh yeah, that's fine. She goes, what do you want to do about something? I says, do I have to do that? She goes, no. I'm like, yeah, then I'm not going to worry about it. Like, I'm fine.
Right.
You know what I'm saying? But I think that what happens is that we have this mindset, especially when it comes to doctors and stuff, that says, well, if he says it, it better be. And we don't realize that, you know what, this is still a numbers game. This is still a financial game for them. And so you start looking, you start saying, well, give me these opportunities to let me decide. Let me decide if I want to see that camera every time. Like, I didn't even get the first time he tried to tell me, like, no, I don't want that, because just I know what it was. But even the next 2 times that I went, he did it again. Yep. And I'm like, wait a minute, why? Like, why are we doing this? Yeah. And that's all that was.
Yeah. And when we have more a free market, what we will have is a wider availability of different experiences. So for instance, I wouldn't expect, if I go to my regular doctor for my annual checkup, it's in general, or if I'm like, hey, I've been having a head cold lately, and I'm going to go in and see what the doc maybe wants to prescribe me something to kind of deal with this so I can function, right? I wouldn't expect necessarily to have, to call up the doctor's office and be like, yeah, I'm having a head cold. And they go, okay, and spend an hour with me on the phone and then send me a whole bunch of PDFs. Right. Like I wouldn't expect all that, because this is a more everyday normal thing. So what I might expect is to call up and say, hey, I have a head cold, or I've got some allergies going on, and I don't have any medication. I would like to resolve this, but whatever, whatever the case may be. And so then I might go in, and so I'm thinking more in the lines of like a routine situation, right? And so what ends up happening is I might be able to go in for routine stuff and actually kind of do what the doctor was telling about, where I don't really need to give you my life story. Yep. Because I'm here for a simple, quick, let's get in and out. Okay. Right? And then that can free up time for, if I can go in and I can say, for somebody else, maybe you come in after me and you say, man, doc, I've just been having
something's not right here.
I don't know what's going on. And, it happens every time, that I eat or something, I don't know, whatever. Right. And so then, the doctor might say, okay, well, we need to spend a little bit more time with you, because DL came in because he's got hay fever. You're coming in because you got an unknown pain, so we can. But
unfortunately, I think the way it's set up now is that they don't. Right. They don't look at it and go, well, I just saved 10 minutes with this guy. I'll let this guy have the next set. That's not how this works. Right. So as you're saying that, I'm thinking, I'm like, okay, so teledoc. Like, I love me some teledoc, because I'd rather not go to the doctor at all. Okay. And so I love the fact that I can kind of say, okay, here's where I'll be available. I'll do this, which I always have this with me anyway. Yep. So I'll be like this. And there's not a whole lot of history. It's just, hey, what's bothering you? Right. You lay it out. Usually, like for me, it's head cold or something like that. Right. And I go, well, here's the thing. The last time I did that, it was a female doctor here in Florida, but she was actually down in South Florida. Right. So it's not even about this guy right here. So isn't that a level of what we're saying, that it's no longer has to be this guy at this place at this time? Right. I can have the luxury of saying, I want to call this doctor. And then in the free market thing, couldn't the doctors decide, I don't do any inpatient. I only do teledoc type. Teledoc is the term for it. But they could say, I only do these from now on. And then I can go, wait a minute. Right. I know it's going to cost me $20 to call this guy real quick, that he'll call in my script still. Right. And so then we'd have that freedom that those doctors could choose. Yep. That's all I'm going to do. Right. And so we want to bring this back a little bit more to the free market. Sorry, Jack. No, you said it very clearly now. Now that Tub went down this way, we got to bring it back again. No. What I want to point out is that some of this stuff happens when you have a little bit more freedom for the doctors to make their own choices. Now there are, so there are limitations. Now, what are all those limitations? I'm not entirely certain of all of them, because I don't operate in that sphere. But I know that there are some insurance issues, right? I know that there are some regulations. So in my mind, one of the ways that we can kind of tie this back in is you could say, hey, and I'm going to make an assumption here. So if anybody's watching and they're in the healthcare, and they're like, these guys are idiots. I can't believe they're trying to fix what we're doing. What I'm ultimately getting at is,
saying a free market that allows people to have interactions on their own terms and simply to be informed of what those interactions entail. So maybe I go to a doctor who is not an ENT.
Right.
But maybe he's just a regular doctor who has studied a lot, and he's, on his spare time, he's, maybe he just finds it very fascinating. He spent a lot of time, and he said, hey, DL, I'm not going back to this idea of a governing board. I don't want to say governing board, but a body like the
peer group.
Like a peer group that says, hey, this is the person to go to. So they might say, okay, John Smith here is not registered as an ENT. So right now, the way it works is if he's not registered as an ENT, he is not permitted to give ENT advice, as far as I know. It's actually illegal. But let's just say that there's not very many ENTs in my area, and John Smith happens to have studied it.
He's a pretty smart dude. Like, I trust this guy.
And so I go to him and I say, hey, man, I think there's some weird things. Maybe I got some tinnitus here. What do you think? And maybe we work on it, and we not work on it, but we take a look at it, right? And he says, okay, well, based on, some things that I've been studying, and the only thing that is necessary is that I know what he has to offer. Like,
how does that turn into payment? Does he make a cash amount that says, hey, you came and talked to me? Does the insurance still cover that? Like, what happens there?
So all that, so we could feasibly have an insurance system that says, look, if you're using us as insurance, we will not pay for you to go to any doctor that does not have
recognized.
That's not recognized by this board, who we believe does a good job of recognizing doctors.
Or they could say, hey, if you go to one of these lesser approved doctors, we only pay X amount of dollars.
Right.
Which then guess what that starts doing? That starts bringing the price of all of those down now.
Right. And so what is that? How does that help out in the real world?
I think we just solved it. I think we just solved the problem.
Right. And so how does that help out? What that means is, I'm a patient. I don't know anything. I mean, I know, I can tell you like, oh, I got this pain. I can tell you, but I don't know why.
Right.
I don't know a lot of things. I don't know if what I'm experiencing is a big deal. So I might say, well, it doesn't seem like a big deal. And so I might go to this John Smith and I say, hey, man, I got these weird symptoms. I've been researching them on Google, and what do you think?
And then he goes like this, and you're like, oh, wait a minute, it's a bigger deal than I thought.
Right. And so he can look at it, and he can say, wow, that's pretty interesting. I don't know that I can really help you, but I think there's something here. And so here's what I'm going to say. And he can like put out
But can you imagine he could do home remedy type stuff along those lines, not just another pill or just this?
Right. And so he might say, try this and come back in a week. And then I come back in a week or maybe 2 weeks or something like that. And then he might say, you know what, dude, that's I think this is above and beyond what I'm prepared to do.
And that's fine.
I'm gonna suggest that you go over to Mr. Jones. Mr. Jones is qualified by this board, and he's gonna be able to really help. So now I've not had to use up Mr. Jones' time for something that may or may not be a big issue.
But more importantly, what this also gets away from is, well, we like to refer to as the cronyism. Right. Is the idea that you go to this doctor, well, I don't really know that, but I know a guy. Because isn't it funny how fast your doctor will give you a referral to this other doctor? Right. And like there was one time they sent me to this other group.
Well, it still happen anyway, right?
Well, yeah, but here's what I'm getting at. Now this guy might actually know him personally. Right. It's not some matchup through insurance or any of those other type of things. It's like, hey, I know this guy. We meet. We have lunch together quite often. Right. Go talk to him. Maybe he can help you, as opposed to that circle of because you might have a doctor who goes, you know what, I'm not going to do a whole lot here, can or can't. Right. I already got my money out of him. Right. I'm going to kick this one up to the next guy. Right. It cuts all that out.
Yeah. And the way the free market could easily work is, let's say that we're talking about John Smith here, who is not a qualified ENT. But he may have a bunch of friends that he went to school with who went on to become ENTs, and they may vouch for him, and they could easily come back and say, hey, you know what, insurance company or governing board or body or whatever, they could say, hey, John Smith here is not qualified as an ENT, but he does good work with people that are coming to him for smaller things. Right. So in other words, they can vouch for him, and then the insurance company can say, all right, well, if a number of ENTs vouch for you, then even though you're not an ENT, we'll pay partial to go to this
that's
doctor.
what I'm saying. That would be the lesser of, we'll pay less amount of money for this one.
We'll pay less.
Now, but
there's a reason for that.
Here's the thing. I find it hard to believe that doctors don't sometimes get stumped.
Right.
This is complex, man.
Oh,
And
yeah.
so I believe that there's times that they do talk to their buddies and go, hey, man.
Yeah.
So isn't it possible that this lower, not an ENT guy can go, man, I just don't get it. And he talks to one of his friends that is an ENT that's been doing it for 30 years. He goes,
Right.
hey, ask you a question.
Right.
You know that happens.
Right.
So wouldn't it be nice if he could then just talk to that guy
Right.
instead of taking his time and all this other
Right.
stuff? That
Just send a
doctor goes,
text
hey, try
message.
this. Yeah, exactly.
Right.
He goes, hey, try this. I hear what you're saying. Try this
Right.
with this guy and see if this works.
Right.
You know what I'm saying? So he can get past his area
Mhm.
without having to send you to there to go through their process, to go through
Right.
everything that they do. So now we get a little more control
Right.
of who we see, how we see, how much we pay, how much we're willing
Right.
to pay, and how much they actually get paid.
Right. And for anybody that's listening that might be kind of skeptical and be like, dude, you're opening the door. So first of all, the door is already open. There's all kind of like medical errors are the third leading cause of death. I'm not so certain that a free market would actually make it worse necessarily.
Once again, standards come up.
Because I think your standards are going to go up because you're going to be really relying on your reputation.
Because
Your
how many
reputation
times do
could make
these
or break you.
doctors have things against them? We don't know.
Right.
Like I don't research. Like I don't
Right.
go like there
Right.
could be things already against him, and I would
Yep.
never know anyway. So what's
Right.
the difference
Right.
at that point?
Right. And then, and we were talking like the first ENT that I went to for my own issue, I went to him and I said, I think I have this really rare inner ear condition. And he was like, okay. And that's fair. Like, he's like, and he does a few tests and he's like, here's what he said. He goes, I don't think you do, but you have an interesting array, or he said, an interesting constellation of symptoms. So I'm going to send you for a CT scan. So I went and had a CT scan.
Think about what that lady said in the video, that they have these set things that they're
Yep.
going to send you to check
Yep.
these.
So I went and had the CT scan. He got the results, and this is what he said. He goes, I'm looking at it. I don't see it. But the radiologist said you did. So I'm going to defer to the radiologist, right?
Okay.
So he defers to the radiologist, even though he's the ENT,
Mhm.
right? So he's the guy that
It's already
he's the
there.
guy that
Guess
I'm
what? It's already
interacting
there.
with, right?
And who would
So
technically
we
have
already
the,
have this system where
It's already
people
there.
are interacting.
It's already there.
So all I'm doing by saying, hey, we should have a more free market, is we should open it up more. And the free market can create boundaries and checks and balances to ensure. And some of those checks and balances would be the same ones we have.
Couldn't you then say, hey, he's about to send me to a CT scan. Well, it would be nice if I didn't have to go just to the place they told me to, because the ENT that I went to, he said, hey, get a head scan, a CT scan. They sent me to their other office to do it on their machine that they have. Okay, so imagine if you could say, okay, wait a minute, I look at these things. I could go to this doctor 3 times, and then he's going to send me to get a CT scan. Or I could go right to the guy who does the CT scan and say, hey, what is your price for me to get a scan on this dome?
Right.
What do we, and he goes, okay, here's what I charge. And then guess what? Now it's already done. I didn't go to my doctor 3 times before we did this. Now I have this done. I go to him and go, here's my CT scan already.
Right.
What do we think?
Right. So the free market argument here, just to make it as super simple as possible so that we can close this segment out.
Yeah.
Yeah, because we're running over it, but it's okay. To close it out, the free market idea here is just to say we want to open it up. We want to be less restrictive.
Mm-hmm.
But not necessarily do away with the checks and balances. We simply shift that responsibility elsewhere. Everybody has the right to be fully informed. So when I go to a doctor, I have the right to know he is not, or he or she is not in a trained ENT.
Yep.
But they may just be somebody that's knowledgeable about minor ENT matters. And so when I go to them, I know that. I know that my insurance company may not pay for it, but I might just go just to get a quick, overview. And maybe he's wrong, maybe he's right. Well, guess what? All these same things already exist.
It's the PA system.
We're simply
it's
opening
physician's
it up.
assistant. It's the same thing.
We're opening it up so that more people can be involved.
Mm-hmm.
And by spreading it out and shifting the way that we're doing things, we allow a greater number of people to actually be involved. So you might see more people, but you shift the amount of time that's available. So when I get to the doctor, that's the good doctor, the guy that's been doing this for 20 years. He's written all kinds of papers. He's done tons of surgeries. When I get to this guy, I need to be at him.
Exactly.
Right?
It's not, I didn't go over the top.
Right.
When I needed a Toyota Corolla, I didn't go buy a Cadillac.
Right.
So it's the same premise of I got to decide. I only need a Corolla right now.
Right.
Okay.
So that's ultimately what we're doing. We're just saying, like, look, the free market needs to be opened up. It needs to be transparent. And when that happens, as long as people know what's going on, they know what to expect, they know what not to expect. And we're not dumb. People aren't stupid. I don't know about ENT matters, but I know when I'm getting good quality service.
Yes.
Everybody knows that. It doesn't matter whether you go to a mechanic or go to the doctor.
Mm-hmm.
You know that. So,
I think that we start like what I said. I think we start with some crazy ideas. We start like this right here.
Right.
Like, let this be the first part of a conversation that starts going, okay, well, they said this. This doesn't apply.
Right.
Okay, that's fine.
Right.
But let's start that conversation going, because there are going to be things like you said. There's going to be healthcare professionals who go, these guys are idiots. They're two guys sitting on it. But there's got to be a level of they go, but the common sense in this says this makes sense.
Right.
Let's start bringing those things together.
And the reality is, it's already happening, as you pointed out, in Maine, Oklahoma. I think it's the Oklahoma Surgery Center, I believe it is. They already do something like that, where you can go in and you can, I believe you pay like a monthly subscription.
Okay.
And there are certain things that you get with that. So like, if you need to come in and get stitches, I believe, if I remember correctly, like when I was listening to one of the guys that started it on a podcast, he was saying like, stitches are just kind of like part of the package. You just get those.
Oh,
right?
okay.
You get a certain amount of text that you can text your doctor. You get a certain amount of visits, for your however much money.
It's a private universal health care.
Kind of.
This is all part of your plan. You can walk in here and just get this done. You don't have to worry about it.
Yep. You already know what you're paying for. It's just like every other plan on the internet. I go to my Netflix and I'm like, all right, how many TVs do I want to be able to stream at one time? 2, 4, 8? I don't know, however many numbers they have. I know, and so I pay for that particular plan. And so we already have this, and it already is functional.
But even just the idea of open up the negotiations of price. Let's be honest with you, a lot of this is price involved.
Right.
And so just imagine if you could start that. It starts with, wait a minute, I don't want to pay that much for this.
Yeah.
Or I can't, or whatever that happens to be.
Right.
You then have some input into how that's going to do that. You have some decisions that you can make instead of this kind of one size fits all. You get lumped into it, and you have to now follow their process to finally get to where the doctor you needed to be at.
Yep. So that's the topic for today, folks. I hope you enjoyed it. Keep watching because we got a couple more. So now we're going to dive into the news and social commentary segment of this episode. So what we're about to watch, we're going to watch a little quick video. It's just I think it's about 1 minute video. It's from the Today Show. And many of you are already familiar with the issue, the incident that happened with Alec Baldwin on the set. So I want to play this clip, and then we're going to have a conversation on responsibility, because I found it very, very interesting as I was watching things play out and conversations happen over social media. So let's go ahead and play this video, and then let's talk about it real quick.
This morning, horror and heartbreak. The film industry reeling from what many are calling an unfathomable mistake, with new details released overnight about the moments before this tragic and deadly accident.
And Emily, there's obviously so many questions, including who is responsible here. So what do legal experts say are the possible ramifications in a situation like this?
Well, Peter, one big question we're all asking is, how did the live ammo end up on set? Experts say the possible, typically in a shooting death, the person firing the gun is the primary wrongdoer. But again, the experts are asking, because Baldwin was told the firearm was not loaded, this may very well be an exception to that. No charges have been filed at this point. But oftentimes on sets, numerous people are involved in scenes like this, starting with the armorer who arranged that cart of prop guns. Still, Peter, the big question, how did that live ammo end up on set? Back to you.
Yeah, one of many questions this morning. Emily.
Okay, so I got a quick question for you, Sue. I put something out, and I actually saw that some people disagreed with me on it, and I thought it was kind of interesting. I said that the end of the line for safety is the person that's holding the firearm. And I had some people disagree with me. Not most of my libertarian peers agreed, actually. But then I noticed, I was watching Tim Pool. Are you familiar with Tim Pool?
No.
Okay, so he's a relatively popular podcaster. He's been around. He's got a way bigger audience than mine. And if you see a guy with a beanie doing a podcast, that's probably Tim
okay.
Pool.
All right. I'm looking for the beanie. Got it.
Yeah. So he had put out that, if anybody goes to the range with him, and that basically they are always responsible for the firearm that they have in their hand. And a lot of people started disagreeing, and they were like, no, there's armorers that are on set, and somebody handed him a cold gun. It's not, people were making this argument that actors should not be held accountable because actors, have somebody on set that hands them a gun and says, this gun is in this particular state and it is safe to use. So what are your thoughts on that?
So if somebody hands them a knife, they don't have to be safe with it.
Right.
You know what I'm saying?
Right.
All right. So real quick, and now I want to add something to this real quick. I am not a fan, obviously, of Alec Baldwin,
Right.
but I cannot begin to imagine what he's going through.
Oh, it's
and I think this is getting lost in it because there's a lot of stuff that's going on through social media and stuff. And they're just really dogging him out, which we'll cover the safety stuff in a second. Which exactly.
Yep.
But he's still a person,
Right.
and being like I couldn't imagine what that would be like to truly accidentally shoot somebody.
Yes.
Now, which leads me into it's his fault. Okay,
Right.
I don't care what you do. I don't care if you're not a gun enthusiast or not, which is kind of funny that the people who are so outspoken about guns, they have no problem with them when they're making money off of them.
Right.
You know, all of a sudden guns are fine because I'm here. But here's where I'm getting at, is that it doesn't make any difference whether you're the full-on libertarian gun enthusiast or you're just the guy who has it.
Right.
Okay? To me, there's a certain thing that you have to understand. And I think you get taught it. I don't care where it's at. You always assume it's loaded.
Right.
Always.
Right.
I don't care who, okay. My father-in-law and I always have a gun on me. He always has a gun on him. That's who I got my gun in your house right now.
Right.
Okay. So I got no problem with that. But here's what's funny. My father-in-law will talk about different things, or he'll get a new one, or we'll the first thing any of us ever do in our circle when for one thing, there's a safe way to hand it to somebody. But more importantly, I don't care how many times we go, no, there's nothing in there.
Right.
We don't care.
Right.
Every stinking time you look, you either pop open the wheel, you slide it, and you rack it, and you clear it. Every time.
Yep.
And so I look at this and I go, I feel bad for him.
Oh, yeah.
But I think that, you know what? It's common. This is what we teach our kids.
Yeah.
You treat this with respect because this will kill you.
Right.
Okay. He's a grown man. There's no training before him that says, hey, I don't care who hands you this. You always check and make sure.
Right.
So I feel bad for him as a person.
Right.
But I look at it and go, dude, come on.
Right. And to be clear, when I say that he's responsible, I'm not saying in the legal sense. Like, I know some people were like, you know, he needs to go to jail for a long time. I do believe that accidents happen.
It does.
So I do understand that. But what bothered me is it felt like the same people that want to go around and tell everybody that guns are unsafe, they kill Americans, that, you know, the same people that want to dominate the conversation on gun control are the same ones that were quick to say, oh, well, it wasn't his fault.
It was his fault.
It was somebody else. But like most everybody that I know in the libertarian community, and libertarians love their guns, most everybody I know was immediately like, nah, it was his fault. He was responsible. He's the person that was holding the firearm. Mm-hmm. He should have double checked. And I made an interesting point to somebody. I said, it's well known that actors will go through great lengths to learn about different elements of their role.
You
know, Heath Ledger, when he was doing the Joker, he read books and he locked himself in a.
And they'll diet and they'll starve themselves and everything to be.
So I'm like, if you read books and you'll consult experts, you know, in a given field, if you're starring in a hacker movie and you go and get computer experts to talk to you about hacking and this is very, very common. So why wouldn't you go out and say, okay, let's talk about guns and let me find an expert.
Yes.
How do I handle this gun? And experts should every single time say, when you're handed a gun, and they have this thing called a cold gun and a hot gun, right? Mm-hmm. Basically, the difference, I believe, if I understood it correctly, was that a hot gun has a live round in it, and a cold gun has basically a blank. Mm-hmm. Still dangerous, but for all intents and purposes, they are almost always a real functioning firearm.
But okay, so here's the thing, and I didn't really realize, because to be honest with you, until you hear stuff like this, you don't put a whole lot of thought into it.
Right.
I mean, we watch movies, they have guns, you don't ever think about who's responsible for it. Like, it doesn't come to mind.
Right.
So here's what I found out the other night. I was watching part of a show, and they had one of these guys who's often one of these people on site of recording. Mm-hmm. And they are the experts. They're the gun experts and stuff like that. He says, no, usually they're always there. They're always on. And I'm like, this guy had done many movies and stuff like that where he's like, no, this is my role. This is what I do. And I'm like, okay, so they had one there? Did they have one? Like, did they cover all of these things? And now listen, I'm not saying this to give Alec Baldwin an out. I'm saying, okay, did they have the experts on site like they should have? Like it seems like all the other ones do. And then they do have a process in place, supposedly, that checks down this line. So, I mean, I guess, and I'm not covering for him, that you kind of go, well, 3 people supposedly checked this before me. I should be okay.
Right.
Now, that's great if I'm talking about that glass of water.
Yeah.
You know what I'm saying? I'm talking about a gun here. Now, I guess my natural sense goes, I'm going to check this anyway.
Yes.
Okay.
Because that's 4 people. That's an additional person to put eyes on it. I mean, hopefully the 4th person's not catching something that was missed by the other 3.
Now, can I
or
ask,
however many.
Right? Can I ask something that I still don't understand in this? Like, I haven't put my head in. I don't know how it happened. Okay. So once again, we all know whatever you aim at, you plan on shooting and killing.
Correct.
That's the purpose of this.
Right.
Okay. How is it aimed at these people who are off camera?
If I saw a couple of videos on this,
Okay.
and it sounded like what was happening was he was practicing aiming at the camera and firing. So he was basically practicing for the role of what he was going to be doing.
Mm-hmm.
Fair enough. I mean, obviously, if you're going to...
I do it at the range. We pull from here for the range.
Yeah.
Yep.
If the script calls for you to pull from your holster and point it and shoot it, then you should probably practice a few times and get kind of the motion down. Like, that makes sense. But I look at it and I say, at the end of the day, you are the person that is grabbing the firearm,
You grabbed it,
picking it, pointing it, and pretending to shoot it, or pulling the trigger, or however it is that you do, right? So therefore, when you pick that up and they say this is a cold gun, thank you. And then if you check it,
mm-hmm.
and then if you realize, I'm kind of doing this motion like it was because it was a revolver.
Yeah.
So I'm imagining
it's like it's a wheel gun. You're popping it out, and
he's popping it out, right? And he's taking a look, and then if he looks and he sees that, hey, something isn't right,
mm-hmm.
then 1 or more people, however many are involved, get yelled at.
Yes.
Maybe even fired.
Yep.
Right? And so, but he is the last person to me in that line of safety
mm-hmm.
that says, I am handling something that could absolutely kill somebody.
Because I have not had possession of it with me the whole time. Mm-hmm.
Right. And so I'm checking it just to make sure. I'll give you a good example of this. I mean, this is what I love about my community, the community of
what's your
gun
community?
lovers, libertarians, gun lovers.
I didn't know if you meant like shorter kind of.
No, I meant
right.
The ones that are going to plan to. Never mind, just kidding. FBI. Oh, yo, I almost got you, FBI. No, so I had a friend a long time ago, and my wife and I went out to her dad's house. And he lived like on the outskirts of the city, and he had like a whole bunch of land behind
mm-hmm.
his property. And she was like, "Yeah, we're gonna go out to the range,
We're shooting, yeah,
we're gonna go shoot." So we got there. Now, my friend knows that I'm prior military, so I have experience
mm-hmm.
with firearms. Here's what she said when we got there. She said, "The range is that way. You will always point the firearm that direction. If at any time you point it in another direction, we're done." This is my friend.
Yes.
Who
knows you have training, who knows what's
doesn't have military training. I do.
What's the first thing you're taught? Always downrange.
Right.
Always downrange.
Right.
Uh-huh.
And here's how I felt about that. I felt good.
Yes.
I felt good.
Because you know why?
People around me.
I feel safe.
Enough.
I feel safe about them. If they're telling me this, they're practicing it also, which
right.
means we're good here.
And she didn't give a damn that how much experience I might have.
Yep.
Because reiteration of the rules every time is how people
get it in there.
How you reduce people getting shot. I mean, accidents still happen.
Mm-hmm.
And I do believe this was an accident. I know there's all these weird.
Yeah, I'm not traveling down that
I don't
road.
care about all
right.
that. I absolutely do not think that he had any intentional, and I think that the man is suffering tremendously because I can't imagine how you would feel.
No.
Especially if you're an advocate against guns, to be the one to accidentally kill somebody.
I think
that's got to be this.
Can we agree that makes it a little bit worse if he's always been so outspoken and that you're the one?
I mean, it does.
Now, let me ask this real quick.
It does give, for some people, maybe a little what they call it, shade and fraud. Like I don't know that I want to engage in that.
Right. I'm like, dude, if you just...
But I think it does open the conversation because to say it's so serious that, yes, everybody that touches a gun should check it before they play with it.
You would think the ones who are so against guns would be the most cautious with them.
Right.
Okay? Let me ask a question. And this is just... And then we better... And, shut this down quick as soon as I ask it.
Yeah.
Is it possible, do you think, however you want to phrase this, if it was a scene of a suicide, instead of shooting somebody else, does the gun get checked closer?
I have no idea. I'm not
like if you think about that. I'm an actor, and I gotta pull this out. So okay, but the scene is telling me it's a suicide. Instead of pointing there, I point it here. Do you think they take an extra minute?
I don't know. That's an interesting question.
And that's what I'm saying. That's why I say you better shut it down as soon as... Because I started thinking about that. I'm like, do we get callous because it's not...
Right.
Oh, hey. Dude, you're not a cowboy. You're not slinging this around like this.
I don't think it's callous. I think it's we become complacent.
Mhm.
Right, and this is the problem that I had with people online. They were like, "Oh no, you got an armor, you got people that told," and I'm like, "That's complacency. You should never ever, when it comes to fire. I mean, other things, yeah, sure, like
But this is different. Like this is different for a firearm as opposed to the one.
if I'm a boxer and I'm supposed to like dive off the set, and fall on some
I'm
boxes
still gonna
or
look.
something like that, I'm probably gonna look. But if I want to be a little bit relaxed and say, I know those guys got the boxes out there or the pad or whatever it is.
Try not knives coming up through.
Like, will I trust them? I guess maybe that's not so bad because what's the consequence of being complacent there? Pretty low. I mean, you can still get
You might get
hurt.
busted up a little bit, but ultimately you're probably gonna.
But I think there are certain things, and people in the gun community know this, and they're very adamant about it. Like you do not pull out a fire. Like you point a firearm at somebody. You better be prepared to shoot them.
That's always my thing. You better be ready because you don't know what they're doing.
And when I say prepared, I say prepared meaning if somebody were to break into my home or there was an incident where I needed to pull out a firearm and point it at somebody because I'm getting ready, I'm going to
This
shoot
is the point
them,
here. Mm-hmm.
I do think it's worthwhile to say I'm going to have a small amount of restraint available in case the situation turns that hopefully I can turn with that situation.
Right.
So I pull the firearm because I'm like, okay, this guy's going to hurt me. I'm going to pull out my firearm. I'm going to shoot this person. But then all of a sudden he drops his knees and says, whoa, whoa.
We're good.
I want that little bit of restraint left to say, all right. So that is the only time that you don't shoot what you aim at.
Right.
Right. When all of a sudden the circumstance changes and you have the opportunity to change with it, then yes, you should. But otherwise, you do not point unless you are intending.
That's the purpose of it.
Right away.
That's one of the first things that I learned about it.
Gun doesn't matter.
Doesn't make any difference at all. Now, here's what's funny is that like I've gone to the shops and purchased guns and stuff, and they pull it out of the case and they put it up there. You know what I still naturally do? You check it.
Right.
It's
always
but it's funny. So do they.
Yeah.
You know what I'm saying? So it's just
when
maybe
everybody's in the habit, then you have more eyes.
Yes.
To catch if somebody made a mistake, because maybe that guy's coming in and he's maybe he's got a toddler like I do and he's drop dead tired and he makes a mistake and you're not and you double check, you might catch the mistake that he made
human error,
the
human error of it. And so if nothing else, maybe a couple of things come out of this. One is it starts putting us down the road of gun safety overall. That now it's become a big conversation because now it's not just those libertarians or those gun freaks who are worried about gun safety. Now they're all looking at it going, whoa, we better be careful with these things.
Yes.
So maybe that leads us down that road and maybe it becomes this more opening kind of like, hey, before you start judging other people for shooting others, you see how easy it can happen now.
Right. And hopefully, and I hate to say this because it sounds mean because I know the guy's going through a personal tragedy on his own, but hopefully it brings a little humility because there's a lot of people out there that are arguing, no, he's not responsible, he's not at fault. And I don't mean in the legal sense, like what should we charge him with? I just mean responsibility and like, hey, you were the last person to touch a gun, responsible, right? And most gun owners that I know, most people that handle firearms are saying, it was his fault. And I think there's a little humility that's needed on the people that oppose guns to say, maybe those people who handle firearms and love them so much, maybe they know a little bit more about what they're talking about than I do. Maybe what they're saying can actually save more lives
if
than
these
what I'm
guys
saying.
who do it all the time, they feel that this is the right process. Maybe I should think about this a little bit more.
Because ultimately, at the end of the day, everybody wants the same thing. The fewest number of people to have to get shot.
Yeah, well, yes. Like I tell everybody all the time, like I make it very clear, I always have a gun. And if nothing else, that's
you got one now?
You know I do.
Okay.
It's always to kind of tell people that it avoids the issue. It avoids the issue of hey, I'm not going to mess with him.
Yes.
Okay. So, but there's this understanding that says, all right, I already have this. This is already where my mind's going to be. I want everybody to kind of be aware of what's going on, and if nothing else, because here's the thing, what we have to understand, Alec Baldwin's not a child.
Right.
Like there are horrible accidents.
Like a 6-year-old man.
So there are horrible accidents when parents leave their guns sitting out and a kid gets it. And it happened to the people who run the street right behind us. It was horrible. The kid would end up being okay. But it happens.
Yes.
Okay? Those are kids. And that's when I'm going to be honest with you. When there's a gun sitting out and a child gets a hold of it, I'm probably going to go to the parent and go, what are you thinking?
Yes.
But like, he's a 60-year-old man.
Right.
At that point, you no longer blame,
Right.
well, my dad handed it
Right.
to me like this. You're grown.
Right.
Like, when do you become responsible?
Well, once we get to the point that everybody in society says, if you are handling a firearm, you are the person responsible for what happens with it. I think what you end up having is everybody starts to recognize this is the acceptable level of behavior when handling a firearm. This over here is the unacceptable level of behavior. And it's funny because you hear a lot of people that say, well, I grew up with guns and there were certain rules that I remember ever since. So my son, he's 2, or he's almost 3, but when he was about probably about 6 or 8 months ago, excuse me, he got some water guns. Now these are water guns, very clearly water guns, right? Like there's no ambiguity.
It's green see-through plastic.
Right, right. I mean, it's very clear what these things are and what they are not. He wanted it. We were outside playing. We were shooting each other with the water, doing our thing. After we're done, he wants to bring them inside. So I said, oh, this is a great opportunity to start practicing. So I took a 5-gallon bucket and I put it by the door. And we came over and we started squirting water out. Now, that's not quite how you would, I mean.
But it gets the idea.
So I'm like, I want the idea that you clear your firearm before you go into certain places, you know, before you go in the house, whatever. You know, before you leave the range, you clear your firearm, right? So in the water gun way, we cleared the firearm. Now, I did that for 2 reasons. One, so that he can start practicing, like, hey, every time that I come in, because I don't want water in my house.
Right.
I don't want to put the TV or something.
Let's be honest. It's not good safety. So I don't want my stuff all wet.
Right. So there's that. But then also the added benefit was like, hey, you get into a routine. Like when I leave a range, when I'm done using this weapon, there are certain things that I must do with it. And it starts with the water gun, and then eventually one day he'll get a BB gun. And
that's what we talked about. We talked about the other day that he'll progress, but he'll already have that instilled in him.
Pellet gun, then BB gun, and then, or I don't know which order is necessary. But basically, when he gets like a BB gun, and then eventually one day he'll have a real gun, if we're still allowed to have them in this country. And by that time, all the behaviors should be reinforced to the point where
it's almost second nature. He's kind of, this is what I do.
He's just like, this is how you handle a firearm. I'm done with the range. I'm doing all these things to clear out my weapon, clean it up, all that good stuff, right? And now it's safe to transport. It's safe to put back in my holster. So, any final words?
No, I think we're good.
All right, folks. Well, there you have it. We talked about the Alec Baldwin thing. Alec Baldwin should be considered responsible, not necessarily on a legal thing. I do believe that he actually did not intend for this to happen. I don't believe any of the crazy conspiracy theories that I've seen out there. But I think that the conversation that we need to have in society is that firearms are always, always, always to be considered loaded whenever you handle them. That's all for this episode. If you're watching on YouTube, be sure to hit that subscribe button and connect with me at Liberty Dad on Facebook, Liberty Dad Pod on Twitter, or send me an email to libertydadpodcast@gmail.com. I'd love to hear from you. To catch Liberty Dad episodes when they air, head on over to facebook.com/Free Speech Media Network, where the weekly episode airs Monday night at 10 p.m. While you're there, be sure to check out other free speech media shows. Prefer an audio format? Find me over at libertydad.com or just search for Liberty Dad, all one word, on your favorite podcast app. Remember, if you're a champion of liberty, your business is people and your product is liberty. Have a great week. Catch you next time, and I'm out.